Hey, there we go. How are you? Good morning. This is DL Walker coming to you live with Correcticise for Life. We're on lesson 10, and today we're going to be talking about something kind of serious, and it's medical errors. And a little background on this is that about 10 years ago, I had my own continuing education company where I taught post-professional continuing education to physical therapists and other professionals. And actually, I kind of just restarted doing that again, getting back into teaching professionals as well as individuals. And in the state of Florida, they have two requirements to maintain your license every time that you recertify. You have to take two courses. One is medical errors, and the other one is an HIV and AIDS class. So rather than having to pay somebody else to take the course, I just developed it myself. So I actually have both of those classes offered for professionals in the state of Florida to fulfill those requirements. So I know a little bit about this. A great book that I used as a reference was a book called Complications. There are many books that are out there that talk about the state of healthcare and medical errors that you are, that I think would be great references to look at. And, this is not meant to, it's not meant to criticize anyone. It's just meant or, necessarily scare you. I think it's just knowledge is power, and understanding choice and knowing that you have choice is super important. And I think that that is, again, the reason that I do what I do is to offer people alternatives and choices. Because just for example, the other day, my assistant came over and she had a painful, movement of her neck that was kind of shooting down her back. And so she, referred to Dr. Google, and which many of us do, and I do myself as well. So I'm not poo-pooing that, because again, I think knowledge is power. And I think that's one of the reasons why the internet is really wonderful, because it gives you opportunity to research a lot of different things and make informed decisions. So what she told me, though, is that everything that she looked up talked about surgery and then pinched nerve and MRI and, all this, other costly and in some ways invasive procedures. And there was only one site that gave her any sort of advice for empowerment. And you know what that advice was? It was to take an anti-inflammatory and see if it goes away on its own. Okay. So again, my mission is really to return the power of healing into the hands of the individual. So when she came over, by the way, I wound up treating her and it went away. So, again, there are so many circumstances that can be preventable when you understand how to do some techniques, simple techniques, the Walker method, obviously, easily and on your own. So let's go ahead and get started with the presentation. And I'll just go ahead and share my screen. And obviously, if you have any questions, please put them in the chat box, either about this or any other presentation that we have talked about. So again, here's just how to, who I am, how to reach out to me, and how to learn more about my work. And again, today we're talking about medical errors. So here's the definition. What is a medical error? It's an adverse event that is considered preventable. So preventable is a keyword given our current state of medical knowledge. So given what is known in medicine, this would be considered preventable. An adverse event is an injury that was caused by medical mismanagement and that has caused a patient measurable disability. Note that all adverse events that not all adverse events are considered to be medical errors. Okay, a bad outcome is different than a medical error because of the state, the current state of medical knowledge, right? So if somebody has a bad outcome, it could be that the current state of medical knowledge has failed them, not that the outcome was preventable. So that is the key difference here. Here's some facts. So medical errors cost $37.6 billion each year, approximately 258,000 deaths per year are caused by medical errors, and it could be as high as 440,000. I'll talk about that below. And it found that 9.5% of all deaths in a hospital stemmed from medical error. That's pretty high. And there's some reasons for that, and I'm going to go over that, but just some stats to be aware of. So again, the reason that they feel that there might be even more medical errors that occur, it can be that they're not reported because of patient confidentiality and liability. So again, I know an instance of a medical error that cost a patient their life that was not reported because of a lawsuit. The second is that it's difficult to quantify the adverse effects of an event or procedure in an already sick patient. So again, this goes back to, predisposing factors that can contribute to the cause of death. You never see obesity as a cause of death. However, certainly being obese can lead to complications that in fact do cause death. And then it says these events are isolated incidents affecting one person at a time versus a catastrophic event like 9/11, which many casualties occurred at one point in time. So here's the top number of lawsuits per specialty, and I was surprised. I thought anesthesia was number one, but tied for number one is general surgeons and OBGYNs. And then comes ENT, otolaryngologists, which are commonly known as ENTs, urologists, orthopedists, plastic surgeons, radiologists, emergency medicine specialists, gastroenterologists, and then anesthesiologists. I remember a funny story from one of I had a patient who was a medical malpractice attorney, a very good one. And he highly interviewed his anesthesiologist when he was having an orthopedic procedure done, because, and he told the anesthesiologist, the orthopedist can maim me, but you can kill me. That is a very important specialty. And, again, there are some excellent monitoring devices for anesthesia. And I think that might be why they are not higher up on the list. As far as lawsuits, so of a group of individuals that medical doctors who were interviewed, 49% of the respondents were involved in 2 to 5 lawsuits, 5% were involved with 6 to 9 lawsuits, and 2% were involved in 10 or more lawsuits. And the top 5 reasons that they were the lawsuits were filed was failure to diagnose or delay a diagnosis. So I had a mammography a year ago, and I had it done in Florida, but my doctor who ordered the test was in New York. She did not get the results for like 2 months. And it turned out that the results were inconclusive and I needed more study. But I was furious that it took that long for my results to get there. And I very much got on the case of the organization where they did the procedure. So if you're having a diagnostic test done, it's up to you to make sure that it gets to your doctor. And that was the lesson I learned from this. Thankfully, nothing was serious, but it could have been, and that would have been a potential lawsuit. The treatment or the surgery related complications. So a teacher at my daughter's school died as a result of a orthopedic surgery that went wrong. And I had a complication of a sterile infection after my surgery, which was a dental implant. So again, minor surgeries, any kind of surgery is potentially life-threatening or life-changing, and that's important to think about or know. Poor outcomes or progression of illness was 24%, failure to treat or delayed care was 17%, and just plain or wrongful death was 16%. So that is, those are the numbers for the reasons why lawsuits have been filed. So there's some systemic problems that are innate to healthcare, okay? And examples of these are providing the wrong medication, performing surgery on the wrong part of the body, an incomplete past medical history that results in a contraindicated treatment. This one is big because many times people will not report something. I remember taking a past medical history on somebody and they failed to mention aneurysm. They had a history of aneurysm. I was like, you have to be very thorough, and that's why filling out those forms are so big and thorough, because you really have people will forget that they have, or think nothing of you're treating my ankle. Why does the fact that I had an aneurysm, why is that important? So again, that could be the case. And then patients not receiving treatment as a result of not being informed of abnormal test results. And so again, understanding, keeping on when you have your tests done, is up to you to follow up to make sure that they've been received by your doctor, and that they will be, and also get them sent to you. You have access to your medical records. I encourage everyone to have a copy of their medical records from their doctor. It is your right. If you're in a hospital, if you've had a surgical procedure, you request the op report. It's your information, and you want to know what happened, especially if down the road there's a problem that a doctor might want to review it, because it might not mean anything to you. It might not make sense to you, but it would make sense to a healthcare professional. So this is what's unique about healthcare, is that it has a far higher error rate than other industries. And there's a number of reasons for that, because they actually feel that there's too much information for a human brain to retain. And now that we have computers and those kinds of things to help us diagnose and help us troubleshoot, those are really great tools, as well as things to look up as far as symptoms are concerned, rather than having to go to research books. So I think that in that area, we're going to get a little bit better as far as those interventions are concerned. But there's another story that I have of a patient who died as a result of the calibration on his radiation machine that was treating him for cancer was not calibrated, and he received over 100 times the normal or the indicated dose of radiation, and that wound up killing him ultimately. And again, when I say that it was underreported, that case was underreported because of the lawsuit that ensued. The good news is that this individual's widow has made legislation in the United States and Canada with regard to calibration of that equipment. But unfortunately, it cost a beautiful human being their life. So a patient in the intensive care unit, for example, on average receives 178 different activities performed per day. That's a lot of procedures that have the opportunity for some kind of error. And in one study of intensive care units, the correct action was taken 99% of the time. Well, that sounds great. However, that translates into 1.7 errors per day, almost 2 errors a day. And 1 out of 5 of these errors was seriously or potentially fatal. And that is scary. So again, if the performance levels of this were compared to the airline industry, for example, that would equate to 2 dangerous landings per day at O'Hare and 32,000 checks deducted from the wrong account per hour in a bank. So, and they say in these industries, such errors wouldn't be tolerated. So again, what can you do to prevent medical errors? And the first one is prevention. Avoid putting yourself in this situation. I mean, I'll say it blatantly, don't get sick. Just, do everything that you can not to become ill or sick. And that includes prevention. So we talked about these preventative things yesterday. the first four. Okay, and again, maintenance, right? If your body was your body is the only body that's given to you, right? But if you were given any kind of car and you were told that this is the only car you can drive for the rest of your life, so it's either driving this car or not driving anything, you would maintain it. Some other advice with regard to medical errors is try the least invasive first. And then, take a look at the risk factor ratio. So the number one indication for a joint replacement, like a hip or a knee, is pain. Because pain can be debilitating. Pain can prevent you from doing activities in your daily lives, which will ultimately lead to death slowly rather than quickly. Also, it causes an inability for you to easily exercise. So you might not exercise because you're in pain, and it really messes up your quality of life. And that's the number one indication to do a procedure. But why not try the least invasive first? Okay, and that does not mean taking an aspirin. It means, searching out physical therapy, for example, as an option to try first. Now, many people do not realize that in the United States, and I can't speak to other countries, it may be even better in other countries, but in the United States, the majority of states allow you to go directly to see a physical therapist. Most people do not know this. We are in the states of New York and Florida and even Rhode Island, where I am licensed, we are allowed 10 visits or 30 days without a physician's referral to treat a patient. So you can go directly to a physical therapist. The only snafu with this is that it may not be covered with your insurance unless you get a referral from your doctor. But you could go see a PT, and then the PT could write a reason for care, and then that could be signed by your doctor to justify treatment that would be insurance reimbursed. And why do I say PT? And this is kind of why I chose PT. I think that the scope of knowledge is incredible when you have an excellent physical therapist. In fact, the profession of the person that correctly diagnosed my infection within a week of symptoms was a physical therapist. And I had gone to a endodontist. I had been in contact with a family member who was the vice president of the New York Dental Association and on the staff of New York Hospital School of Dentistry. And he couldn't diagnose it. And neither could the surgeon that did the procedure, who was trained by my family member. None of them clearly diagnosed it. And I even noted to them that I felt a palpable mass, which turned out to be a fistula, and none of them got it. I even showed it to the endodontist. I said, "What is this?" He had no idea, but correctly diagnosed by a physical therapist within a week. And I think nursing, I would go along the same, because we work with patients. So when you've worked with, you see 10 patients a day, times, let's say you work 48 weeks a year, times 10 years, those are a lot of cases. And what happens is, and nursing I think would be similar, maybe even more. But what happens is that you get to know the patients, and obviously you remember the errors. You certainly remember, potential errors that you make, but then you also obviously remember the errors or the complications that your patients have gone through because you've lived it with them and it affects you. So again, when I say the individuals to talk to about a referral, physical therapists, nursing, certainly doctors, although again, there can be some biases there, as well as medical malpractice attorneys. So again, trying the least invasive first. And so when you look at malpractice insurance, as a physical therapist in the United States, my malpractice insurance is about $200 and some odd a year versus the thousands of dollars for medical doctors. And the reason being is that physical therapists are rarely sued. because what we do is not invasive, or it's not potentially, certainly, unless you're manipulating, and there are cases of manipulation causing serious injury. The majority of what we do is not invasive at all. And again, so it's kind of a method of our training. And so again, what I was saying about medical doctors, I don't fault them for anything, because they are highly trained and skilled at their modality. However, their modality happens to be really invasive and potentially dangerous, right? Medications and surgery, both highly invasive. So again, to avoid medical errors, try the least invasive first. And there are a ton of less invasive professions and practitioners that you can seek out. So then again, look at the risk factor ratio. So again, is it affecting your quality of life and really need an intervention? Is it life-threatening and really requiring an intervention? And then also timing. So for example, joint replacements. Joint replacements last about 15 to 20 years. So it's a great idea to schedule your joint replacement, at about age 70. So you only have to have one, 70, 75, okay? And lastly, how do you choose the correct practitioner? And again, we went through this pretty much the other day. You really want to go with somebody who's an expert at that procedure. So here's another story. Andre Agassi, you can guess I like tennis. His last US Open, he had a back problem. And so he wound up getting a steroid injection in his back. Guess who did the steroid injection? It happened to be the doctor for the US Open championships. However, that doctor is a shoulder specialist. Now, this Andre Agassi is worth, that him winning that tournament was worth hundreds of thousands of dollars, right? Why did he have, when, there are excellent back doctors, right? In New York City, I'm sure, who would love to have said that they injected Andre Agassi. Why the heck would he go to a shoulder specialist? Makes no sense. It makes no sense. I mean, obviously, I'm still emotional about it. I was a big fan. So I'm like, what are you doing? What are you doing? So again, expertise. You want to go to the person who does this thing all the time. They are the Mac Daddy. They are the person that, that does this procedure because they do it all the time. They're good at it. In fact, in Canada versus the US, I remember this from the book that I was telling you about, is that they have surgeons that only do hernias. That's their only type of surgery that they do. And their medical error rate is far lower than in the US, where it's a general surgeon. So again, you want to go to a specialist. Experience, we talked about emotion, how passionate are they about their job? Most people who've gone through surgical training are pretty damn passionate. So I'm not terribly worried about that one. What's their MO though? Are they doing this just to get a paycheck, or is it because it's really indicated? I tell people that if a surgeon tells you you do not need surgery, then you do not need surgery, because they're doing the right thing by you. They're being honest. So listen to them. Obviously, again, are they in alignment with what you believe, right? So if you want to go to a general practitioner who has more of an alternative bias, or pediatrician for that matter, choose your person whose feelings about health and well-being are in alignment with yours. And then I talked about resonance, does it feel right, their reputation, and then certainly their results. We talked about that yesterday when we talked about resilience. And with that, I will go ahead and end my presentation and talk about what we're going to do tomorrow. Tomorrow, I'm going to share with you, I did already, some of my experiences and, why I do what I do, what led me to choose this path in my profession. And I think you got a sense of it so far. And I'm going to give you some case studies of people that I've worked with who have really benefited from taking the power of healing into their own hands, or making really good decisions about their health and how it translated into their life. So if there are no questions, I will go ahead